Hi, I'm Mary Mitchell. This is my Week 8 live video.
I'm Quincy Bake. Can I give her permission to record?
Alright, and before we get this video started, I'll show a scan of the room to confirm I do not have any scripts present. Okie dokie, let's get this video started.
I'm in.
I'm performing hand hygiene, putting on my gloves, and as well as providing my patient with privacy. Hello, Mr. Banks. How are you today?
Good. How are you?
I'm doing good. Thank you for asking. I'm Samaria Mitchell. I'm a student nurse at Chamberlain University, and today we'll be performing a head-to-chest assessment on you. It'll take approximately 20 minutes at tops, and we're just doing it just to make sure everything is functioning correctly and you're in good health. That'll be okay?
Yes.
Alrighty, so the first thing we'll do is confirm that this is our patient. So we'll have him state his name
Quincy Banks.
and his birthday.
September 26, 2006.
Yes, this is our patient. So we'll ask, do you have any allergies?
No.
Alrighty, and on a pain scale, 0 being no pain at all and 10 being the worst pain in your life, what would you rate your pain today?
0.
Alright, so my patient has no pain. So off general inspection, we will note that my patient shows no sign of acute distress. His posture is up straight. He's not hunched over, showing any dire need of air. His speech is clear. His mood is pleasant, and as well as his facial expressions are appropriate for the situation. So next we'll make sure that my patient is alert and oriented, and by that we'll have him state his name,
Quincy Banks.
birthday,
September 26, 2006.
where are we?
Home.
Yes, and what month is it?
October.
Okay, and who is our current president?
Donald Trump.
Okay, so we would note that my patient is in on ×4. He is alert to himself, the time, the place, and as well as the situations around us. So next we'll do a closer look at our patient and we will assess his skin and his nails. So off the bat, we will note that our patient's skin his color is appropriate for his ethnicity. His skin is warm to the touch, and as well as we will look anteriorly and posteriorly at his skin to make sure he has no incisions, lesions, or wounds anywhere, which I do not see, so that's good. So the next thing we would do is move on to his nails, and we will note that his nail beds are round, they are also pink, and as well as there's no clubbing present, and we would check his capillary refill, and note that they refill within the 2 second, or less than 2 seconds, so that's what we want. Next, we will move on to our patient's head, and we will palpate around his head, make sure we don't feel any lumps, bumps, or indentations. And while I'm at the top of his head, I will look at his scalp to make sure there's no lesions or infestations of his scalp, which I do not note today, so that is good. So then we'll move on to his face to make sure that it's symmetrical. And how we do that is we look at our patient's end of his eyebrows. We'll have our patient smile to the ends of his smile lines. So you'll move down and you'll note that he is symmetrical. So now that we're on his face, we will look at his eyes. So we'll have our patient look at us and we will note that his scleras are white. We'll have our patient look up. His conjunctiva are pink and moist. His pupils are round. They're equal in size, as well as his size is 2 to 4 millimeters, which is the normal size range, which is what we want. So next we will check to make sure that our patient eyes react to light and as well as they accommodate. So with that, we'll do a couple eye tests. So I have my patient look at me. Okay, good. And as well as we'll do a couple eye tests. Keep your eyes on the pen. Okay, good. So they accommodate as well. So my patient eyes do pass the Perla test, which means that his pupils are equal, round, and reactive to light, and as well as they accommodate. Also, I did not know if I stated before or not, but first looking at his eyes, I did not notice any redness or irritation or discharge as well. So he has none of that. So his eyes are clear. So next we'll look at his ears and note that he has no redness or discharge or drainage from his ears. And we know that his hearing is intact due to previous conversation. He had no trouble hearing me or responding. And then we'll move on to our patient's nose and note that it is symmetrical, and we'll have him look up. We'll look and note that there is no deformities, inflammation, redness, or signs of drainage. His septum is in the center, which means his nose is symmetrical within the inside. And it's staying up sturdy. Good. So next we'll check to make sure that our patient nostrils are bilaterally patent. So by that we'll cover one nostril. I have my patient take a deep breath in and out. Okay. And again. All right. Any trouble?
No.
All right, good. So my patient has bilateral patent nostrils. Next, we'll move down to his mouth, and we'll note that his lips are pink and moist, and we'll have him open. And we'll look around, and we'll note that his gums are pink and moist, as well as his tongue is pink and moist. So that's what we want. And now we'll move down to my patient's chest, and we'll note that he has no accessory muscle movement, just his normal respiration movements, which is what we want. And then we'll listen and also take to his lungs to confirm that there's no adventitious lung sounds, just his normal clear lung sounds bilateral. So I have my patient stand up, and we'll listen to him anteriorly and posteriorly with the diaphragm of our stethoscope. Okay. And we'll listen to the lungs in a Z pattern. So we have right upper lung, left upper lung, right middle lung, kind of sort of like here, and then left lower lung, right lower lung, left lower lung. And just for more sounds to hear, you can move more lateral and do right lower lung and left lower lung. Okay, so anteriorly we heard bilateral clear lung sounds, no adventitious sounds. So next we'll have a patient turn around, and he's in reverse. This is the right, this is left. When listening posteriorly, you listen to the top of the lung above the scapula. So his scapula is kind of high, like this is the bone right here, so I'll kind of listen here. So we have left upper lung, right upper lung, and again we'll do that Z pattern. And we have kind of avoid the scapula. So left lower lung, right lower lung, left lower lung again, right lower lung, and then again more laterally, so left lower lung and right lower lung. Okay, and again posteriorly, bilateral clear sounds. You can have a C. So no adventitious lung sounds noted. Next, we'll move on to assessing my patient's cardiovascular system. So with that, the first thing we'll do is we will check his JVD, which is his jugular vein distension. If I had the appropriate bed, I would have my patient sit at a 45-degree angle. I would have him turn his head to the left, and I would look at the vein along his neck. Now, if it were to be distended, that would show signs of built-up pressure. So what we want is for it to be flat, so we would assume that my patient's JVD was flat. So next, we will check his carotid pulses, and with that, we check them one at a time, and we want them to feel strong and on a rate of 2+. Yep, I got that one right away. Okay, good. And they're both strong and on a rate of 2+. Next, we will auscultate my patient's heart sounds. We will do this twice. One side with the diaphragm to make sure we hear the lub-dub sound, and that means that S1 and S2 are noted. And then we listen with the Bell side of the stethoscope to confirm that my patient has no abnormal heart sounds such as heart murmurs. So I have my patient stand up again. And first we will listen with the diaphragm side. Okay, so we have aortic area, pulmonic, Erb's point, tricuspid, and mitral. And S1 and S2 are noted. And next we'll listen to the Bell side to make sure we hear no heart murmurs. So again, we have aortic, pulmonic, Erb's point, tricuspid, and mitral. Okay, you can have a seat. And I note that S1 and 2 are noted again. I did not hear any abnormal heart sounds or heart murmurs. So next we would check my patient's radial pulses, his right and his left, and we want them to feel like the carotid pulses we did earlier, which would be strong and on a rate of 2+. Good. Okay, good. Okay, so on both sides, right and left, I know that my patient's radial pulses were strong and 2+. So next, with the end of the assessment, we would just assess our patient's pain scale again. So on the pain scale, 0 being no pain at all, and 10 being the worst pain in your life, what would you rate your pain today, Mr. Banks?
0.
So Mr. Banks is still not having any pain, which is good. We do not want to hurt our patients. I will thank Mr. Banks.
You're welcome.
Okay. I will perform hand hygiene, and I will thank you guys for watching. This concludes the assessment.